Now, the much talked about medical tourism as it affects in Nigeria is now like a double-edged sword that cuts both ways. Both the doctors and the patients go outside our shores in droves for better treatments. According to reports, 4,528 Nigerian doctors moved to the United Kingdom in 6 years. So when and how would this exodus stop? Babajide, let me start from you again. And I don't know, it's so scary. Now, considering the numerous strikes by doctors since 1984, does it surprise you that more than 4,000 doctors have left Nigeria for greener pasture in the last 12 years?
Oh, 6 years. No? I think
Yes, 6 years. Yes.
6 years.
Yes. It's not a surprise. The environment is toxic. Doctors want to give their best, but they are not encouraged. We place greater emphasis on funding bureaucracies that do not offer value to us, rather than funding the health sector. And as you have seen, in 1984, when doctors went on strike, when the enemy went on strike, you saw what happened. It was President Buhari who was in power then. They were thoroughly dealt with, detained people like Bekor and Sonkuti at that time. But those agitations have not stopped. The only way the agitations can stop is if we do what is right. And how do we do what is right? Let us start from funding. Let's commit to allocating a much bigger chunk of our budget to funding that sector. That's the way it's done elsewhere. I don't want to use the worn-out cliche, Sena climbs. We don't want to use it. We can compare ourselves to other countries, great countries. In many sentences, Nigeria features along with countries like Chad, like Somalia. It's such a shame. You know? But we want to be seen among the best in the world. So, and I'm saying, when you are talking about the best in the world, they don't give this kind of paltry funding to the health sector as well as the education sector. Politicians, public office holders shouldn't be earning as much as they are earning by way of allowances, not salaries. It's not as if their salaries are unheard of. It's the devil is in the allowances that they earn. And those allowances, you and I are not even privy to, to the allowances. They treat it like
Top secrets.
Yes, they don't want anyone to know. So if we can start by funding the sector at all levels of government, fund the sector sufficiently, then we can build as many health centers as possible, both primary and secondary and tertiary health centers across our country, so that we can bring quality health care to the door of the average Nigerian. We really have to do that for the average Nigerian. So this is the thing. Doctors are not simply complaining about their welfare. They are also complaining about the environment, which does not allow them to give their best. So we have good funding, sufficient funding, and the restructuring of the sector will help us solve some of those problems. It has to start with sufficient funding.
Emeka, looking at the current demands by resident doctors, are they really impossible to meet by government at all levels?
Well, it depends on what the government terms as a priority. If the government believes that the health of its citizenry is a priority, government will find a way to meet the demands of the doctors. Because demands also includes paying benefits of dead doctors, doctors who died during COVID-19. This thing dates back to 2014. 2014, you made agreements with them. That was the previous government. You reached agreements with them, and then the new government came in and reneged on all the agreements. Then the doctors went on strike. You said, don't worry, trust us. We will do this, we will do that, we will do everything. And then you promise certain things. You move them from one platform, give me this platform to IPPS. You stopped it. In some states, doctors have not been paid they are not being paid their full salaries. You are owing them benefits. You're talking about COVID-19 raging. You're talking about COVID-19 raging again. Other variants, another variant of COVID-19 raging across Nigeria. And then doctors are frontline workers. They interact with patients. They are on the direct firing line, of COVID-19. Now, why wouldn't you do all you can to make sure that doctors return to work? You negotiate with them, meet their demands. They have done their best. They have tried. They have really bent over backwards. But the unfortunate thing is that when you listen to the Minister of Labor and Employment, Dr. Chris Ngige, you are so disappointed. He's a medical doctor, but he doesn't even give hope that that sector needs that government can actually do anything to make the sector better. He just keeps personalizing issues. Doctors should not do this. It's not about persons. You see, that is where many administrators in Nigeria get it wrong. Like they say, soldier go, soldier come, barracks remain. The doctors will be there and will leave. You see many of them leaving. Over 4,000 have left. Has the situation changed? Has the situation changed? No. Between 2015 and this year, over 4,000 have left. And you are still there saying that doctors should not do this and should not do that. But the problems remain. So unless you regard the human capital in this sector, you regard the practitioners in the sector as human capital that must be harnessed into valuable manpower, the brain drain will continue. It's even going to worsen because the language employed by some of our leaders is really, really disgusting. You keep threatening them as if these people don't have an alternative. These are professionals. And the world, look, let me tell you, the world is a global village. You can migrate with your skills. As long as you have your skills, you can migrate with your skills across different, geographical jurisdictions. So when you are threatening doctors, all you are just doing is you are trying to postpone the evil day. You believe you keep churning out doctors, and as you are churning out doctors, parents of children who want to read medicine will say, okay, why would I subject my children to such a thing? Let me go the extra mile, make sacrifice, and so that my children have nothing. Many of my children that want to be a medical doctor doesn't have anything to do with Nigerian healthcare system. Who suffers? The ordinary people. But the same people who are grandstanding, huffing and puffing, will hop on the next plane and go abroad for medical treatment. What are we talking about?
They don't use public hospitals.
Even do you remember in this country that some years ago a serving minister at that time died of malaria, was said to have died of malaria in a British hospital. If you remember, let's remember very well. Look at the ailments. Politicians, serving government officials have died of in foreign lands. Yes. These are things that doctors can treat here. But what do we have? We make sure, we use force. You cannot.
Emeka, we call ourselves giants of Africa.
Yes.
But we go to Egypt. Medical tourism to Egypt is huge. Egypt. Yeah.
What about Ghana?
Egypt.
Let's go to Ghana.
And we even go to Cameroon. A lot of our people in Adamawa State,
yes,
they go to Cameroon. What are we talking about?
Okay, joining us via Zoom for more insights on this issue of medical tourism is Tokunbo Otitoju. Thank you for joining us, Stokes. Now, first and foremost, why do your professional colleagues always want to go abroad? Is it simply economic or migration or the prevailing conditions here or both?
So we used to talk about migration now, and I think that migration is now a milder term. They are now escaping. They are escaping abroad. Escape is different from migration. Now, every doctor in Nigeria, after writing the last paper, is thinking of leaving the country. That's not the usual migration that we used to have. They want to escape from the system. So I think maybe we should put it in clear terms. They are escaping from the situation that we have found ourselves. A lot of people think that it's based on economic migration alone, but no. a lot of doctors don't even want. I don't focus on the economic aspect of migration. Migration is common everywhere in the world. You can find American doctors in Dubai, you find them elsewhere, you find Indian doctors all over the world. But what we have in Nigeria now is more of people just want to get out of the system, and it's not the economics alone that is responsible. They want to train, they want to be better, they want to hone their skills, they want to attain the same level of expertise like their colleagues in other countries abroad. And when they graduate in Nigeria, you find out that they can barely further their education. The situation in Nigeria, our training colleges cannot even accommodate the number of people that we graduate every year. So they cannot become consultants. They cannot train. Residency program cannot even take them. So the first step is to look for other countries where they can further their education. A lot of my colleagues that traveled abroad went there because they could not get into the residency program in Nigeria and they had to move abroad. They were not comfortable being medical graduates with MBBS alone. They want to be specialists, they want to be sub consultants in several fields of medicine. So they move abroad to practice in other countries. The second one is, of course, the working condition, which is very, very bad, which is very, very poor. And the working condition is not favorable to them. I mean, they are overworked, they are overburdened, um, they are not happy. Most times going to work, the work environment is bad. It's a toxic place in most hospitals, especially the government hospitals to work, and they don't see themselves excelling in that kind of situation. You know, that's why when you visit most government hospitals, you find out that you can hardly see a doctor smiling. Probably the doctor has been working on 72-hour shift, um, 3 days call, back to back, no rest, no proper meal or decent call room for them. A lot of factors, I mean, in many of these hospitals. So the work environment is bad, and then they decide that, look, I've had enough. I'm not living my best life here. Let me move. And then the third one, of course, is the remuneration. A lot of them move abroad because they want better pay. When you enter medical school, your family gives you everything to support you. They buy the textbooks, they pay for your fees. As low as our tuition fees are in Nigeria, medical students pay a lot. And then when you graduate, everybody starts looking up to you that, okay, what can you now contribute to the family? How do you take care of us? How do you take care of your relatives, your dependents and all? And then when that pressure comes, they start considering other areas where they can make more money. But that's not the major factor. That's not the major reason why a lot of doctors are leaving Nigeria. They are leaving because they cannot train. They are leaving because they cannot further their education. They are leaving because the working condition is bad. There are doctors that have been working in some hospitals in Nigeria and they've not been paid for months, and they still go to work. Doctors do a lot of pro bono services. So if it's because of remuneration alone, uh, there are a lot of doctors who are really happy to even work, continue to work in Nigeria, even if with that level of remuneration. But the other factors, training, welfare, working condition, is so bad that they have to take the options that they have. And like Mr. Babajide said, uh, healthcare expenditure in Nigeria is very, very low. Very low. Our healthcare per capita spend is low. We have a very large population. Our population projection is alarming. If you look at the UN estimates, and we have one of the highest birth rates in the world, and we're not spending so much on healthcare to match the population growth. So if you look at the federal government budget, um, the last budget, 2021, was 549 billion for the federal government, which is about 4.7% of the total budget. And this is still below the 15% recommendation, that every country must spend on healthcare. So even if you aggregate, and mind you, this budget, 75% of it goes to recurrent expenditure. So you have about 20% left for capital investment. Or if you aggregate all the budgets of other states, you will find out that we are still spending a little compared to other countries. The UK, for example, has a budget of about 212 billion pounds. If you want to get that context, convert it to naira, and then you see how much that money is. And they spend at least 10% of their GDP on healthcare. Nigeria spends 3% or 3.8%, between 3 and 3.8% of our GDP on healthcare, compared to South Africa that spends 8.25%, and Kenya spends 5.2%
Yeah, Tokubo.
on healthcare. Yes, yes, I can tell
Yes,
you.
more than 4,000 doctors in the last 6 years is such a huge number. You agree with me? Now, which countries
Yes,
are
I
they
agree with
going
you.
to, and what are they offering them?
Was
So like I said, they are going to other countries that where they can train. Countries like the UK, countries like Canada, countries
Australia.
like the US as well.
All over the world.
But of recent now, they are even going to other countries like Saudi Arabia. They're going to other Asian countries. I mean, so it's becoming very, very worrisome that Nigerian doctors will prefer to go to countries like Saudi Arabia, where they are not even as free as Nigeria, but they just want a system that works for them. So, and it boils down to the health sector itself. Where do we start from? The funding is low. Government
now,
cannot do.
let me just
Yes,
jump in. If you were to go to the UK to continue your career as a medical doctor, as
yes,
somebody just starting to work in the UK as a medical doctor, how much
yes.
are they going to pay you? If you are going to Canada or Australia, how much are they going to pay you per month? It's just we want to be able
Yes.
to compare the wages that they get paid over there with what they get paid at home.
So, starting salary in most parts of the world, especially the US, Canada, and maybe the UK, I mean, some of them get as high as $60,000 per annum. Um,
So
then, as they
if you want to
progress
break
in
it
their
down,
career, as the $6,000, maybe $5,000
That's
per
like
per
42
month.
million.
A month.
Uh, yeah, that's 2 million or 2.5 billion per month. And then as they progress in their career, when they become consultants, when they become surgeons, they can start taking home as high as I mean maybe $200,000 per annum. $200,000 per annum is about
TVC.
$15,000 per month. $15,000 per month is about 8 million or 9 million, 8 million or 9 million naira per month. So that's a lot of money, and that is
Nine.
that is hello, that is the economic aspect of it.
And you know,
Nigeria may not be able to match these
okay,
these
yeah,
figures.
Jackie, you
Nigeria will
know,
not be able to match these figures because of our prevalent economic indices. So we also have to factor in the standard of living in those countries. The standard of living is very high, so a lot of their wages may go into taxes, um, mortgage, and all that. But in Nigeria, where we have a very low standard of living, at least they deserve a decent wage in Nigeria here as well, because you cannot compare like for like, wage for wage with Nigeria. If we do that,
Okay.
and
That's
then
the first,
no
third, and
country will be
fourth.
able to
Third one.
match or survive the
Third
Western
question.
world because they have more money and they have more resources to put into
okay, let's talk
healthcare.
about practicing
But with,
in Nigeria now. Are doctors overworked here? Do we have enough, as the Minister of Health once claimed?
Do we have enough doctors, as Ngige claimed?
As the
the,
ideal
the, the,
proportion of population to a doctor?
the statistics are there. I mean, the statistics, no, but the statistics, it's available online. You don't even need to listen to anybody before you can have the facts. Our doctors are not enough. He is judging based on sub-Saharan African standards, which of course we are very close and we stay below the standard. But the global standard, we are far, 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 far behind. And I mean, the WHO standard says that you should have 15 doctors to 10,000 population, and Nigeria, we're currently doing 3.8 to 4 doctors per 10 population, which means that we need about 3 times or 4 times the number of doctors that we have. If for us to be able to say, okay, we are at the global average. And we don't even need the global average. We need more than the global average. If you look at our population estimate, the growth trajectory of our population, so we are not even supposed to be looking at the global average. We're supposed to be looking beyond the global average. So on the MDCN website, you find out that Nigeria has about 73,000 qualified doctors. Currently practicing in Nigeria, we have about 40,000. And in the next 10 years, WHO is saying that you guys need to have about 320,000 doctors to match the global average. Now, remove the number of doctors that have retired, doctors that are in other lines of business, the ones that have moved abroad, and the ones currently migrating abroad annually, about 2,000 doctors moving out and escaping from Nigeria annually. Then you will now see the magnitude of problems that we have. So I don't think the minister should be comfortable at all in any way to say that we have enough doctors. We don't have enough doctors. We have enough doctors in certain parts, certain cities, because every doctor wants to work in some parts of Nigeria, maybe Lagos, Victoria Island, and Lekki. You can have enough doctors around those places. But when you start moving away from the popular areas, the cities, and you start moving into the hinterland, you find out that in a local government, you probably have one doctor. You may not even have a doctor in a local government, maybe a nurse or a traditional birth attendant in an entire local government. So I don't know where the minister got his statistics from and what they have done to arrive at that conclusion that we have enough doctors. I, for one, I can say clearly.
Can we really stop
Yes.
this brain drain? How would you describe the doctors trained here and the quality of the training they get?
The Nigerian doctors have shown over time that they can be the best in their field. If you travel to the US, you will meet Nigerian doctors doing wonderfully well. If you go to the UK, a lot of my friends are there in the UK. They are the pinnacle of their careers there. Specialists, specialists as well. And they are the most sought after. If you are not properly trained, no country will come for them. They pass their exams at one sitting. A lot of my friends who took their exams abroad passed it at the first sitting. So they best their European counterparts, they best their Indian counterparts. They are doing very, very well. If the training was deficient back home, they wouldn't be able to meet the standard abroad in such a short time. So a Nigerian doctor gets to the UK today, the doctor adapts within 6 months, starts to excel. And it's a function of the environment. So back to your question that can we stop this brain drain? Yes, we can stop it by investing more in healthcare, by funding healthcare. And then we have to go back to the...
Tokuba. Hello, Tokuba. Yes, Tokuba, you're giving us an insight into what is happening in the our health sector. And then I'm sure my producer will still try to reconnect him. Julie, at least we have a fair picture.
Hello?
Yes, okay, Tokuba is there. Now, should the eye care delivery be privatized here?
Should that be considered?
So we need to look at it. We need to look at it critically. Where will we get the money from? Okay, our per capita spend now is about $82 per head compared to the global average of $1,200. And look at the valuation and look at inflation again, and you know that we are in a very dangerous situation. So where do we get this sustainable way of financing healthcare from? The government cannot do it. The entire federal government budget match the state allocation to healthcare. It's not enough. It's not enough to push us to the global average of that per capita spend. I just told you now that the United Kingdom plan to spend £212 billion this year. Change that to naira and look at the number of trillions. Where do we get this money from? It's not going to come from the government, not from petrol or oil dollars. We are not even getting enough from that oil dollars again, and our population keeps growing. So we need to find a sustainable way of financing healthcare, and that's when we have to start looking at pulling funds through health insurance. Health insurance will help us lower the cost of healthcare, and then it will help us also improve the quality of services and guarantee affordable and accessible healthcare services to Nigeria. Then again, we need to start attracting private investment into healthcare. Some companies have taken up the challenge down to start investing massively in healthcare. I know some companies in Nigeria like Afia Care, they've started investing in healthcare, building hospitals and all. We need to start encouraging healthcare, private investment into healthcare. And the Indian model is there. India attracts a lot of private investment into healthcare. In 2018, they were able to attract $697 million. That's about $1 billion investment into healthcare in 1 year alone. So because the Indian healthcare system is driven by private investment. India has poor people as well. Like Nigeria, if you go to South Africa, you find out that private investment dominates the entire healthcare space in South Africa. So we need to start looking for ways of encouraging private investors to come into Nigeria and start investing in the healthcare space. We don't even need them to come into Nigeria as such.
Okay, quickly, before we go, Tokumo,
to attract private investors in Nigeria. So we need to start seeking alternative means of financing healthcare. Now, health insurance first, and then we need to start looking.
Let me ask you this question before we go. Now, let's talk briefly about the current strike. Who is to blame?
I think this is not the time to start pushing blames. We all have to share the blame, because it's not the doctors alone. Starting from our communities, starting from the leaders that we have, starting from each and every one of us, our attitude to healthcare. If I ask this question now, how much do you commit to healthcare every year? Your income, what percentage of your income do you commit to healthcare every year? You find out that Nigerians spend a little on healthcare. We just believe that, oh, God is going to solve every problem and every challenge for me.
We are not generalizing. We are saying the strike,
yes.
the current strike, was the current strike avoidable? If it's avoidable, who do you blame for the fact that the resident doctors are back on strike?
I blame the government first because, of course, the government owns the hospitals and then they run the hospitals through the Federal Ministry of Health. And then I will blame. I'm not going to blame the doctors. They don't have any blame. They deserve to work better working conditions. They deserve better working conditions. They deserve better wages. They deserve to get the best training in Nigeria. So I'll blame the government. And then instead of dwelling on blames, I would rather say that it is time for every one of us to sit up and see healthcare as population health. It's every one of us. If this sector goes down, a lot of Nigerians will be affected. And then we need to start pushing for proper reforms in the healthcare space. Every one of us, we have a role to play in our communities, in our place of work, ask for proper health reforms. We need to start looking at ways of financing healthcare. We need to go through the insurance way. We need to start attracting private sector funding. The government must know at this point in time that it cannot finance healthcare. We need to start attracting private investments towards healthcare. Government should do more of regulation instead of spending. The money is not there. Hello?
Thank you so much.
Hello?
Tokubo,
thank you.
We want to thank you for your time. Thank you.
All right.
Yes.
Thank you very much.
Thank you, Otitoju, talking about the crisis in our health sector. It's multidimensional.
Yes,
Can't just.
I'm not surprised because I've engaged him many times on these issues, and I'm not surprised that he's spoken in this manner because he is passionate about better healthcare in our country, but the conditions prevalent are making it difficult for us to achieve our aim of solid healthcare delivery for our people. I just hope that in the next couple of years, things will begin to change. Otherwise, 4,500 plus leaving the shores of our country after being trained by their country,
But all our
In just 6 years,
medical
it will get worse. It will get worse. You go to medical college here, where benefit from training here,
around the country.
and it's cheap to train doctors in our country. It's very cheap.
Heavily subsidized by the
It's-
government.
Yeah, now, when they need to serve their country, they do not wait to serve their country. They go abroad. It is Nigeria that is the loser at the end of the day. So
Look at the way it started now. He said they are not migrating, they are escaping.
they are escaping. Yes, it's not
Like
it's-
somebody running.
they just want to leave the environment and
it's not
go
conducive.
elsewhere. It's just terrible.
Emeka, when Tokubo was talking about them escaping, I had another man that, look,
of course.
if you continue to stay here, you will just die here.
Of course, I mean, it's across so many sectors. I mean, if I look back, I remember 1986. I was much, younger. My mom retired as a nurse, as a senior practitioner in the nursing sector. And I remember then how doctors and nurses were collecting forms.
Saudi Arabia.
Yeah, Saudi Arabia and all
That
of
I
that,
remember.
just because we're
To
relatively
go to
young,
Saudi.
that my mom didn't collect, they didn't join the exodus. But many of our colleagues, well, I'm talking about specialists left the country.
The best.
The best left in different fields, left the country for Saudi Arabia and many other countries. So when we talk about escaping, you see the economic conditions in the country are not favorable. Talking about remuneration, he put it third, but I think it's even first because whenever you get a job in Nigeria, as long as you're earning something, you have at least 3 to 5 dependents.
Yeah.
So your parents who have spent so much training you, if they are not economically self-sustaining,
You must give back.
They expect that you give back, and then your relations. You're a medical doctor, so that is an elite profession. So they expect that something must come back. So what do? You look, you just weigh your options, and then family members could even contribute money and help you hop on the next flight and take off from the country.
If there is saying their counterparts in the United Kingdom, 9 million, 10 million. Look at the disparity. And I can tell you the private hospitals that I'm talking to you in this Lagos paying doctors 100,000, 120,000.
Of course.
And to make things worse, there are some governors who do not see anything wrong in owing doctors as
for
much
9 months.
as 9 months, 11 months in this same country. You've given someone the mandate to go and to be saving lives, and you do not pay him, and they go to work every day, and people are wondering why doctors are on strike. You've got to ask those people, do they even know what they are doing? You are not paying doctors, and you tell them to go and save lives, to put their own lives on the line, to save the lives of people afflicted by COVID-19. I mean, it's ridiculous. I was asking someone, I said, are you sure this thing is true? Somebody called me to say that of Abia is true, that he knows.
Yes, Abia, Ondo, Imo.
I was owing people, you are owing doctors, of all people.
Just pay them 62% of their salaries. Owing them between 2014 and 2016. Even doctors that died, you've not given them their benefits.
19 of their colleagues died.
They are saying, okay, give us insurance cover. Give us insurance cover. Give us universal health coverage. So that, you see, the thing is this, if you make sure that, it's possible to pull funds from Nigerians, expand the national health policy, and you can pull more funds, the sector will be better funded.